Hey, welcome back to the Reimagine Healthcare podcast. Noah here. So, I want to talk about something today that sounds kind of abstract at first, but stick with me because I believe it matters way more than you'd think. Who owns your healthcare? No, seriously. When you go to the doctor, when you fill a prescription, when you're dealing with insurance, who actually owns that system? Like, who's making money when you pay your bills, and where does that money go? Most people never think about this. And honestly, why would you? You've got enough to worry about. But here's the thing: ownership shapes everything about how healthcare works. It determines what gets prioritized, what gets funded, what gets ignored. It's like the operating system of your phone. It is running in the background and nobody sees it, but it controls everything. And in Southern Oregon, we've got this really interesting example of what happens when you change that operating system. It's called AllCare Health. Look, I know we've talked about AllCare before on this podcast, but today I want to zoom in on something specific. Not what they do, but who they are, the structure, the ownership model, because I believe that's the whole ballgame. AllCare serves about 70,000 people across Jackson, Josephine, Curry, and Southern Douglas counties. It's got about $472 million in annual revenue. That's significant scale, right? Not some tiny boutique operation. But here's what makes it different. It's owned by nearly 50 physicians and nurse practitioners who actually practice medicine in this region. These aren't investors in New York. These aren't hedge fund managers. These are people who see patients every single day in the same communities where AllCare operates. And that matters. Like, it really, really matters. Let me break down why. Most healthcare in America falls into one of three buckets. You've got for-profit corporations, think United Health, Anthem, the big insurance companies. They answer to shareholders. Their job is to maximize profit and hit quarterly earnings targets. That's just how publicly traded companies work. Then you've got private equity. We talked about this a bit in earlier episodes. Investment firms that buy healthcare organizations, make changes to boost profitability in the short term, then sell at a profit a few years later. Studies show pretty consistently that when private equity takes over, costs go up and patient outcomes get worse. But hey, the investors make money. Third bucket is large nonprofit hospital systems. Now, these are technically nonprofits. They don't pay taxes, but a lot of them operate almost identically to for-profit corporations. They accumulate billions in reserves, pay executives millions, compete aggressively for market share. The tax status is different, but the behavior? Often pretty similar. AllCare is none of those things. It's physician-owned with community-accountable governance, and that creates a completely different set of incentives. So think about how this plays out. When the physician owners at AllCare decide to invest in, say, housing for people leaving psychiatric hospitalization, which they did, we talked about this in an earlier episode, they're not approving some abstract line item. They're going to see those same patients in their practices next month. They're going to witness firsthand whether stable housing helps people manage their mental health better. That's not hypothetical. That's direct feedback. When they fund transportation services so people can actually get to medical appointments, they see fewer no-shows in their own schedules. They watch their patients with diabetes get better outcomes because they can make it to their follow-up visits. The incentives align. Their financial stake in the organization aligns with community health in a way that's basically impossible in traditional corporate structures. Now, AllCare also did something really smart in 2018. They became what's called an Oregon Benefit Company and got B Corporation certification. You might have heard about B Corp. companies that meet high standards for social and environmental performance. AllCare scored 136.5 on the B impact assessment. The median score is like 50.9, so they're nearly triple the benchmark. But forget the score for a second. What matters is the legal framework. As a benefit company, AllCare is legally obligated to consider the impact of its decisions on patients, workers, communities, and the environment, not just financial performance. That's written into their corporate structure. Why does that matter? Because traditional corporate law often constrains leaders to prioritize profit maximization, even when they personally want to do something different. You've probably heard about corporations getting sued by shareholders for not maximizing returns. That's a real thing. The benefit company structure gives AllCare legal permission to prioritize long-term community health over short-term profit. That's not rhetoric. It's actual legal protection for making decisions that might not make sense on a quarterly spreadsheet, but make total sense over years or decades. Max Janasic, AllCare's CEO, has basically said, AllCare's structure gives us the freedom to find and fund creative ways to address health needs. That freedom leads to better problem solving. And Dr. Kelly Burnett, the chief medical officer, is focused on each community has different needs. You have to be on the ground to understand how to make a system work. That's the key phrase. On the ground. When you're owned by people who live and work in the community, you can't ignore what's actually happening. You're not looking at demographic data from 2,000 miles away. You're seeing it in your clinic, in your emergency room, at the grocery store, at your kid's school. So what does this look like in practice? Let me give you some examples. Board decisions at AllCare are made by clinicians practicing in the communities served, not executives managing portfolios across multiple states. The people making strategic decisions are the same people who have to live with those decisions professionally and personally. Surplus revenue gets reinvested locally. Programs addressing transportation barriers, housing transitions, language access, stuff identified through actual patient experience, not corporate strategy, consultants making educated guesses. Long-term planning becomes possible if you're a physician owner and you expect to practice in Jackson County for the next 20 or 30 years. You can invest in prevention and early intervention that won't show financial returns for a decade. You're still going to be here to benefit from it. And here's something interesting. AllCare supports independent providers rather than acquiring them. Most big healthcare systems grow by buying practices and consolidating market share. It's a power move. AllCare maintains its roots as an independent physician association and contracts with more than 1,500 local specialists and hospitals. They're strengthening the network instead of owning it. For families and employers, this isn't just philosophy. It's stability. It's continuity. It's knowing that decisions are being made by people with skin in the game. Let me tell you a quick story that illustrates this. There's a woman from Glendale who got a routine outreach call from AllCare about colorectal cancer screening, just a regular preventive care thing. She got screened, they caught cancer early, she got treated successfully. Now think about that from a for-profit insurance perspective. Preventive screening programs cost money up front. The benefit might not show up for years. If you're trying to hit quarterly targets, that's a tough sell. But if you're a physician owner who's going to be practicing in Glendale for the next 20 years, and you know early detection saves lives, and you're going to see that patient at the grocery store and at community events, that math looks completely different. The time horizon changes everything. Josh Ballock, AllCare's Vice President of Health Policy, has basically said, since we're locally based and locally engaged, we make sure care is available where people actually live. That sounds simple, but it's radical when you think about how most healthcare organizations operate. They optimize for profitability, which usually means concentrating services in profitable areas. Rural communities get left behind. Small towns lose access. That's just market forces doing their thing. But if you're owned by physicians who practice in those rural communities, you can't abandon them. You live there, your neighbors live there, your incentives are completely different. Okay, so let me zoom out to the national picture for a second, because this matters for understanding why AllCare's model is significant. Nationally, healthcare ownership is moving rapidly in the opposite direction. Private equity investment in healthcare has absolutely surged over the last decade. We're talking hundreds of billions of dollars. And the research is pretty clear. When private equity takes over, costs go up and outcomes get worse. But the investors make money, so it keeps happening. Physician ownership has been declining steadily for decades. Back in 1983, about 76% of practicing physicians owned their practices. By 2022, it was less than half. That's a massive shift in who controls healthcare in just 40 years. And consolidation has shifted decision-making further and further away from patients, clinicians, and communities. Decisions that used to be made by a doctor who knew the local context are now made in corporate headquarters based on system-wide metrics and financial models. Against that backdrop, AllCare's durability is instructive. They've been operating for more than 30 years with this model. That's not a flash in the pan. That's a sustainable alternative approach. And it suggests something important. Scale alone isn't the answer. Bigger isn't automatically better. Structure matters. Incentives matter. Governance matters. There might actually be an optimal size for healthcare organizations, large enough to be efficient and have some negotiating power, small enough to remain genuinely responsive to local needs. AllCare might be operating right in that sweet spot. So look, here's why I care about this, why I think you should care about this. At Reimagine Healthcare, we're not trying to sell you on specific organizations or promote particular companies. We're trying to help people understand how systems actually work so they can make better decisions. And ownership is one of those things that shapes everything, but almost never gets discussed. When you're choosing a health plan, either individually or through your employer, do you ever ask who owns it? Probably not. Most people look at premiums, deductibles, maybe which doctors are in network. That's all important. But who owns the insurance company? Where does surplus revenue go? Are decisions being made by people who live in your community or by people who've never been here? Those questions matter too. For employers evaluating benefits for their workers, same thing. You're looking at costs, coverage, employee satisfaction, but the ownership structure of the healthcare organizations you're contracting with that determines whether they're incentivized to keep your employees healthy or just manage costs quarter to quarter. For clinicians thinking about where to practice, ownership determines your autonomy, your ability to make decisions based on patient need rather than corporate protocols, whether you're treated as a revenue generator or as a professional. And for community leaders thinking about long-term health resilience, like what does this community look like in 20 years? Ownership determines whether healthcare organizations are invested in that future or extracting value now. AllCare's model demonstrates something pretty simple. Alternative ownership and governance models are possible. They work. They produce measurably different priorities. Does that mean AllCare has solved every healthcare problem? Of course not. Healthcare is complicated. There are a million challenges, but it shows that the dominant models, corporate chains, private equity, massive nonprofit systems, aren't the only options. And in a system where decisions often feel opaque and reactive, where you're just getting bounced around between providers and insurers who don't talk to each other, clarity starts by asking better questions. One of the most important is simply this: who owns the system making your healthcare decisions? Because ownership isn't neutral, it shapes priorities, it determines incentives, it influences every single decision that gets made long before you ever walk into a clinic. When physicians who actually practice in Southern Oregon own the organization serving 70,000 people here, they can't ignore housing instability because they see it in their exam rooms. They can't ignore transportation barriers because their patients are missing appointments. They can't ignore the long-term health of the community because they're part of that community. That alignment is rare, and it's powerful. So next time you're dealing with healthcare, whether it's picking a plan, navigating a crisis, or just trying to understand why things work the way they do, ask that question. Who owns this? Where does the money go? Who benefits when decisions get made? You might be surprised how clarifying that question is. And you might start to see why we spend so much time on this podcast talking about structure and governance and ownership instead of just treatments and technologies. Because the system that delivers care matters just as much as the care itself. All right, that's it for today. Thanks for listening. If this got you thinking differently about healthcare ownership, share it with someone. Talk about it. Ask questions. And if you want to dive deeper into any of this stuff, AllCare's model, benefit company structures, physician ownership, subscribe to the newsletter at reimagine-healthcare.org. Also, I do my best to get the facts right, but if anything is incorrect, please leave a comment or contact me through the website so I can correct it. I'm Noah Voles. Take care of yourselves and each other. I'll see you next time.